In this episode, I'm going to introduce you to the 4 parts of Medicare. One of the questions I get asked the most when it comes to Medicare is, what is Medicare? So today I'm going to teach you a little bit about how Medicare actually works. Medicare was actually signed into effect. Original Medicare is what we're going to call it. It was actually signed into effect in 1965 by President then, which was Lyndon Johnson. We had a Medicare Part A, we have Medicare Part B. Medicare Part A is basically just your hospitalization. If you're put into the hospital overnight, you're going to get a bill from the hospital for your room and board charges. That falls under Medicare Part A. As long as you have worked 40 quarters in your lifetime, basically 10 years, or you've been married to somebody who had worked 40 quarters in their lifetime, 10 years, when you turn 65 years of age, the first day of the month that you turn 65 years of age, you're going to be eligible for Medicare Part A, which is basically your hospitalization, your room and board charges. There is no cost for Medicare Part A. Medicare Part B, this is all your other medical bills. When you go see your doctor, when your doctor comes to see you in the hospital, the surgeon, the assistant surgeon, the anesthesiologist, physical therapy, anything other than your room and board charges outside the hospital are basically going to fall under Medicare Part B. Now there is a charge for Medicare Part B. The current cost right now these are your medical expenses. The current charge for Medicare Part B, depending on your income, is $134 a month. 3 years ago, they created an organization the government did called IRMA, Income Related Medicare Adjustment. For those individuals that are entrepreneurs and did very good in their life and they make over $85,000 a year, you're going to pay a little bit more for your Medicare Part B. Still no charge for Medicare Part A, but you're going to pay a little bit more for Medicare Part B, which is actually tiered according to your income. But for the majority of people, 51 million people who are on Medicare, your monthly cost for Medicare Part B is going to be $134 a month. Now with this, you're going to get a red, white, and blue card, your Medicare card, which is going to have your Social Security number on it with an A after it. What will this card do for you? This card, which is basically Medicare, which is basically the government, will allow you to go to any doctor, any hospital, any clinic, any facility you want anywhere in the country, have anything done that's medically necessary that Medicare approves, and in general, the government's going to pay 80% of your medical bills. This is going to be, if it's set up right, and I can help you do that, this is going to be the best medical coverage that you've ever had in your entire life. And the decisions that you make are very important because this will be the medical coverage that you have for the rest of your life. So now you got the freedom to go to any doctor, any hospital, any clinic, any facility, anywhere in the country, have anything done you need to have done, and the government's going to pay 80% of those medical bills. So what about the other 20%? So most people purchase what we call a Medicare supplement or Medigap insurance, which does exactly what it says. It will fill those gaps or supplement what Medicare leaves you having to pay. And when done right, it will fill those gaps at 100%. Now, depending on your age, your zip code, where you live, whether you smoke or not, there's going to be a cost involved with this Medicare supplement. On average, a Medicare supplement for a 65-year-old female, again, depending on what part of the country you live in, is going to run anywhere from $100 to $120 per month. And what does that supplement do? That supplement pays the other 20% of what Medicare does not. So between Medicare, your red, white, and blue card that you've earned over your lifetime by paying into your FICA, your taxes, they're going to pay 80%. you're going to purchase a Medicare supplement to cover the other 20%. Well, according to my math, that's 100%. So again, when you become eligible for Medicare, which is when you turn 65 years of age, you've got the option to go with Medicare Part A, Medicare Part B, purchase a Medicare supplement or a Medigap insurance, and have the best coverage you've ever had in your entire life. So this is original Medicare. This is how it was meant to be when it was signed into effect. And it's still available today. But there's been a few changes. As you well know, especially during an election year, we're told how much Medicare is broke. So in 2006, first of all, here's what we just went over. Your original Medicare, signed into effect in 1965 by Lyndon Johnson. You got your Medicare Part A, your Medicare Part B, no cost for A. You're going to pay something for Part B. Again, for most people, it's $134 a month. So there's really two sides of the fence. In 2006, the Bush administration came along and they actually created two new Medicares. So you got Medicare Part C and you got Medicare Part D. Well, most of you getting close to the Medicare age know what Medicare Part D is. D is for drugs. This is the Medicare Part D prescription drug program. Prior to 2006, my seniors that were on Medicare, paying for their prescriptions was tough. The Medicare Part D prescription drug program is very helpful to the seniors in paying for their prescription drugs. But let's talk a little bit about Medicare Part C. The government decided that it would be better if they third-partied it out. Over here, you've got Medicare, the government paying 80% of your medical bills. Over here under Medicare Part C, the government decided they would pay an insurance company. I'm going to get rid of D, move it down a little bit. The government on this side of the fence. Now remember, you've got two choices. You can be on this side of the fence, what I call the good side of the fence. Why is it good? You can go anywhere you want to, have anything done you need to have done that's medically necessary, and if done right, not pay 10 cents on a medical bill. Over here, the government decided they're going to give an allowance to an insurance company, a subsidy. They're going to pay that insurance company a subsidy, and now that insurance company is responsible for all your medical bills. They're responsible for taking your phone calls, paying your claims, sending you your ID cards. So the government basically third-partied it out. Now another name for this, you hear it every year between October 15th and December the 7th, is called an annual enrollment period. Another name for this is called a Medicare Advantage Program. I'm going to put an A for Advantage Program. So, how does this side of the fence work? Well, when this first came out in 2006, they had what they called private fee-for-service. Well, what does that mean? That means you go anywhere you want to, and as long as your doctor would accept that program, you were okay. Well, you can't find those anymore. Then they went to PPOs. PPOs aren't so bad, a preferred provider organization, which means we would prefer that you use our doctors in our hospitals and our clinics. But if you don't, you can go outside of the network. You're just going to pay more money out of your pocket. Most of you are familiar with that from your group health insurance, a PPO. But what we're seeing is they're eliminating a lot of the PPOs, there's still a few of them left, and going to HMOs. Now, HMOs are a little more restrictive. That's a health maintenance organization, which basically means you will use our doctors and our hospitals and our network and our clinics. But if you want to go outside and you find your own doctor, you can. We're just not going to pay anything on your medical bills. So what we see is under Medicare Part C, the Medicare Advantage, is it's become more restrictive as compared to the good side of the fence where you got the freedom to go anywhere you want to. What we also find on a Medicare Advantage is the insurance company says, hey, you're going to put some skin in the game. You're going to have a co-pay or co-insurance, which basically means each and every time you go and have something done, you're going to pay something on that medical bill. Now, there's a limit in a calendar year as to what you can pay out of your pocket. It's normally $6,700 if you stay in the network, or $10,000 you could have to pay out of your pocket if you go out of the network. Now again, if I'm talking in the network, out of the network, I'm talking about a PPO, not an HMO. Remember, an HMO is even more restrictive, where you will use our doctors, our hospitals, and our clinics. So this example where you've got a maximum calendar year out of pocket if you stay in the network, and a maximum out of pocket if you go outside their network, we're talking about a PPO. So the bottom line is, on this side of the fence, you're going to put some skin in the game, and you're going to have more restrictions as to where you can go, have services. You're going to have more restrictions on how much your bills are going to cost you. In return, what normally happens is you have a lower premium. This is an incentive for people to pay a lower premium, but it's actually going to cost you more out of your pocket in the long run if you have some type of medical costs on this side of the fence. But those are the two choices that you actually have when you become eligible for Medicare. Is the original Medicare, where you got the freedom to go anywhere you want to. If it's set up right, you don't pay anything on your medical bills as long as it's a Medicare approved charge, as opposed to having a lower premium on a Medicare Advantage program, but you're going to pay something out of your pocket each and every time you go and have something done. So here's what you need to do. 3 to 4 months before you turn the age of 65 years old, you need to evaluate, first of all, your financial situation, because there are costs involved when it comes to Medicare. You need to evaluate your health situation. If you've got health issues, once you sign up for one of these programs, they're pretty much going to be with you for the rest of your life. Now, you do have an opportunity when you sign up for a Medicare Advantage to switch to another Medicare Advantage, but if you're on a Medicare Advantage and you want to go over to the good side of the fence, that's pretty tough to do. You got to answer about 12 health questions, and if you answer yes to those health questions, you're not coming over to the good side of the fence. So it's very important, because this is one of the biggest decisions you'll make for the rest of your life, because this will be the health care for the rest of your life. So evaluate your financial situation, what the costs are going to be on your budget now, especially if you're retiring, what the costs are going to be in the future. Evaluate your health situation, because if you've got health issues, you might want to consider going on the good side of the fence and staying on the good side of the fence. This is an important decision. You really need to do your homework on this decision, because more than likely the decision you make will be the one that sticks with you for the rest of your life. I'm R.L. Jones, and that's your financial news for today. So if you like this video and you want to learn how Medicare works, I'd love to have a conversation with you. Just give me a call or shoot me an email.